Thank you for the opportunity to speak on this very important motion tonight. I'd like to thank the contribution from some of the members of the opposition in this regard. We have some very strong shared concerns in this area, and you know, it is a source of great concern that 1 in 4 people, as you have acknowledged in your motion tonight, are affected by mental health. You know, there go I, but for the grace of God. And you know, it is critically important that this House and this Dáil deliver and take whatever action necessary to deliver critically important services within the community. I fully support and applaud the Minister's commitment with regard to the policy and the programme of government. It is the intention of this government to break the perception that mental health can only be delivered within an institutional environment of care. We need to tackle that. But we also need to ensure that we adequately resource the delivery of community-based services. And I suppose to try and break from the perception that the only possible quality delivery can be through the state agencies or the HSE, we need to acknowledge the great work done by the voluntary and community sector in that regard. In particular, I'd like to focus some of my words in relation to Outhouse and a lesbian, gay, bisexual and transgender community resource centre based in Dublin, whose primary objective is to ensure that they can support clients of services on the issue of mental health issues. Outhouse is a frontline service provider. It provides a safe space for people to get information, support, organise and build capacity to act. It's very often the first point of contact for LGBT service users to find a safe space to talk about concerns that they have in relation to emotional isolation, coming out, homelessness, alcohol and substance misuse and abuse, self-harm and suicide. It's this type of model, Lascan Corla, when I talk about community, that we need to extend above and beyond our effort to address the scourge and the great stealer that we know as mental health. The work, as indicated to me in my discussions with Outhouse today, the current work involves a minimum investment on behalf of the state, where the delivery of important and often life-saving services can be delivered through volunteers, through volunteers and peers who can provide support and deliver a frontline service to often what we would consider marginalised people within our society. I welcome the great work of organisations such as Outhouse, who refer their work to across the sector in terms of the Garda Liaison, the Gay Garda Liaison officers, the Public Interest Law Alliance, HSE Social Inclusion and the HSE Mental Health nurses within the community. And we must endeavour to work and support with these type of partnerships to ensure that we deliver modern public services that deal with the emergence of mental health within that community. There are great demands, Lascan Corla, to provide and ensure that we increase resources to this community, because the reality is that you know, Irish society needs to deal with the stigma of mental health, but the difficulty that mental health issues that are associated with the lesbian, gay and bisexual transgender community. In future, I would like to see organisations that are absolutely dedicated to mental health be supported under the provisions of the proposed government legislation. And in that regard, there is a commitment in the programme of government to retain and ring-fence spending under the vision of change in the programme of government, which provides for an additional ring-fence €35 million annually from within the health service budget.
No, made one.
This is critically important, you know, to try and send out that signal that this government, in austere times, are serious about debunking the notion that we don't wear the issue of mental health on our sleeves. We are proud to get out there and associate ourselves with this issue. It's not an issue that we want to sweep under the carpet. It's one that we want to invest in services, to deliver critically important services to vulnerable people in society. I welcome the opportunity to speak on the motion tonight, And it's critically important for us as a government to listen to what the opposition have to say in this regard, because there are some very valid proposals in this area that we need to consider very strongly.
Thank you very much, Deputy.